is Dr. Phil Stiver. I'm an orthopedic surgeon with Tri-State Orthopaedics. Did my undergraduate study at DePaul University in Greencastle, Indiana. That's where I met my wife. Then I went to Indiana University Med School in Indianapolis, did 4 years there, and then did an internship at St. Vincent's Hospital in Indianapolis. And then I did 2 years of general practice in northwestern Montana. After those 2 years of general practice, I came back to Indiana University for my orthopedic surgery residency training, finished that up in 1984, and then came to Evansville where I started my practice. My specialty is primarily joint replacements. When we first started, it was more general orthopedics, but as our group has enlarged, I've been able to subspecialize in total joints so that about 90% of my practice is joint replacements for both hips, knees, and shoulders. My philosophy is do what's best for the patient and try to be of assistance, even if it's not in my area of orthopedics. A lot of times we see patients and what they end up having as an issue ends up not being an orthopedic problem, but I don't want to just discard that patient and say, I'm done with you. You need to go see somebody else. I want to help be a triage for that patient so they feel like we're being helpful to arrive at a proper diagnosis and treatment for that particular patient. I decided to go into orthopedic surgery because it fit my personality. I'm probably a little bit ADD and I like to do things. Sitting in an office and treating blood pressure and diabetes and talking with patients isn't a bad thing, but it's not my personality. I'm more of a doer. And orthopedics really fit my personality in terms of doing, more immediate gratification. You see people with problems in orthopedics. More often than not, there's a short-term solution to that. And I like being able to do that and see the results of our intervention. I like practicing at Tri-State because I love the field of orthopedics. It's fun to see people come in with an issue that we can help them and then see the results of your treatment, the fruit of that by taking away pain, repairing an injury, trying to restore them to function, or helping them handle disabilities that they have and work with them. It's just a privilege to be able to do that. One of the other things I like about practicing at Tri-State is the community. The Midwest is a friendly, family-oriented community generally. And it makes it fun to see people who want to get better, who take responsibility for their health care, and you can be a part of a team. It's a team approach. We appreciate the faith that patients place in us by choosing to have health care here at Tri-State. So we thank you for choosing Tri-State Orthopaedics for your health care choice.